And we just want to take this opportunity to give you all a voice to speak to what is it that you're saying, what is it you're demanding, and by when. Peterson, we'll just start with you to just broadly, Mariam asked a good question, maybe just between COVID and today, there just seem to have been some glaring gaps and a lot of promises made and not followed through on. Give us that kind of snapshot very briefly, and then take us to why we're here today having this conversation and why it's important.
Thank you, Janet, and I must thank NTV. And I think we have to give NTV also their flowers. They have really supported the cause of the UHC workers. So let me start by clarifying about the engagement of the universal health coverage staff. The 8,551 health workers were engaged in 2020 and 2021. And I know that there has been a confusion whether they were engaged for UHC or it was for COVID. So there are two sets of contracts. The one for the universal health coverage staff was not actually for COVID. It's only that coincidentally, when they were employed, so that then they would help this country to actualize the dream of achieving universal health coverage. Then just when they were starting, COVID set in, and then they had to start by fighting COVID. But there was also another contract for CHAP, and that was the one that was specifically for COVID. CHAP means COVID-19 Health Emergency Response Program. So about the UHC program and why the staff were employed. You know, when we are defining the enablers of the universal health coverage, there are three things that we look into. We have accessibility of the health service, we have the quality, and then we have the affordability. So the government realized that for you to be able to provide that access, which is a primary tenet of UHC, then you must have an adequate number of the human resources, and we are having a dire shortage. And that is why the national government, realizing that the county governments where this implementation happens, did not have the capacity to employ these people. In the spirit of capacity building, they then recruited this staff and they gave them to the counties so that they can be able to capacity build them in terms of human resource, and so that then they can be able to assure them of the needed accessibility. They can assure citizens of access to a healthcare worker closer to them. That is why they were engaged, and you remember that is when we were piloting. But you know, ironically, the same government that wanted to ensure that we have accessibility, but also with the quality that comes with it, they engage this staff at a third of the salary that they engage the other people. And this was only supposed to happen for 3 years or less, because they were given a contract first of 3 years, and this was supposed to enable the government to budget, provide the requisite budgetary allocation, so that they can be able now to harmonize the pay and absorb them into permanent and pensionable. 6 years down the line, we find ourselves, I think we have been promised twice now. We were promised when they were employed, after 3 years, we are going to harmonize and put them on PNP establishment. After that, we protested because we saw it was not happening. Then they say, no, we still don't have the budget. Why can't we extend for 1 year as we look for the necessary budgetary allocation? Then after that 1 year, the same thing happened. And the agony that you are seeing, the reason as to why these UHC staff cannot trust the government anymore is because on 2 instances, they have been promised. And those promises have been broken. So, but what has really broken them is that last year, you remember, there was a joint sitting between the 2 houses of parliament, the National Assembly and the Senate, the health committees. And all the stakeholders, including ourselves, we were invited there. After deliberation, it was agreed upon that within the 2 years, the budgetary allocation should be provided for the absorption. But looking at the budget 2025-2026, and their contracts are ending on April of 2026, there is no budget. And so they felt that this is the third time that now the government is really taking them in rounds.
Okay.
Yes.
Mariam, I'll come to you in just a moment. Thank you for setting that pace for us and getting us that context. We also really want to speak to the conditions that are making this work unsustainable whether it's physically, whether it's in terms of what is being earned, whether it's emotional, right? And I think it would be so important to just hear a lived experience from one of you here to just take us through what is it that is making this so difficult to do. Amariam, I don't know if you have somebody near you.
Right, and Bernard is a UHC worker. Would you like to share, Bernard? Can give you the microphone, yeah. So you're absolutely right. Let's hear maybe from the beginning. COVID, was that when you got contracted? What were the conditions like, working conditions as well as payment conditions? Has anything changed over time? What are your challenges at work, Bernard?
Thank you so much. So we started working as a COVID-19 since 2020. We worked under harsh conditions when everybody else in the country was working at home. So us as the UHC staffs, we worked under critical conditions, and we're earning a quarter of the other colleagues we are working with.
Mm-hmm. What do you mean the other colleagues? You mean people at the same job level as you?
Yeah.
But you're earning a quarter of what they are earning?
Yeah.
Continue.
So we are earning a quarter of what our colleagues we are working with in our counties and in our workplaces. Mm-hmm. So this makes us maybe mentally disturbed, and we are not progressing. We have worked here for the last 6 years, or this is the 5th year now. Mm-hmm. We have not have a job progression. Even the working conditions, even making it worse for us as the UHC staffs.
Right. That part about the working conditions, let's start with during COVID. Oh, you want to share on the working conditions? Mm-hmm. Yes.
Yeah, thank you. My name is Brown. I'm the SG for Public Health Union, and thank you, NTV, for bringing us on board. I think as union leaders, we've been categorical. The working conditions have been very dilapidated. If you look at even these people are working, remember, in an environment where we also have other permanent and pensionable colleagues who are equally receiving a salary equal to the Salaries and Remuneration Commission terms, but somebody's receiving a lesser salary compared to what the colleagues are actually receiving. And it will tell you for free that it actually demotivates them. It's actually a demotivating factor. And also it's important to bring in the legal aspect here. It's against the Employment Act, Section 5, that talks about even discrimination at workplace. It's not fair to pay somebody less amount, actually delivering equal service of the same equal amount. So really, the government, we find it not very, very good. And this unfair terms, that's what's actually calling out the unfair terms, and we want them to be corrected.
Mm-hmm. Right. Okay. I see another official speaking. Yes. Just before we go to you, Mohammed, are you a UHC worker?
No. I'm official.
All right. So yes. We also want to hear from the workers themselves, but go ahead, and we'll hear from Mohammed as well. But yes.
Thank you. Good morning. I'm Nicholas Odipo. I'm the national chairperson, Kenya National Union of Medical Laboratory Officers. To start with, before us is an issue that is really depressing. Because if you look at the laws that govern employment in this country, it has been violated. And if you look at the terms of employment, whereby somebody is having contracts being renewed more than 3 times, that is in itself illegal. So the terms of work in itself is so harsh for these our colleagues. And we also need to look at the aspect how they got into this, which Washira here has talked about. So these people have been working for 6 years without things like leave allowance, because there are certain allowance that are being given to the healthcare workers. They leave the house allowance, this extended allowance, this health service allowance, and so on and so forth, even the house allowance. So if you look at the Employment Act, the house allowance is something that is supposed to be paid by the employer. That one, it is non-negotiable. So if an employer decides to have a consolidated salary, you cannot understand whether that consolidated salary contains house allowance that is mandatory under the Employment Act to be paid. Number two, these colleagues, they are actually the frontline workers, and they are supporters of the primary healthcare, because majority of them are working in level 2, level 3 hospitals. And these hospitals are hospitals that are situated in rural areas, whereby you find that when a mother comes at night, it doesn't mean that you are at night, you are not supposed to be on duty. You are on duty 24 hours. So imagine you are working 24 hours and then you are not given the extraneous allowance that the other colleagues who are in permanent and pensionable terms are earning.
Right.
So that is something that is discriminating, and it is also giving these people depression, because now you are the extraneous allowance is supposed to cater for the overworking that you are doing,
yes,
and especially working outside the normal working hours. And then these colleagues are not able to get that. Sorry? Oh, no. Okay, thank you. Let me because.
All right. I'd love to hear from one of the UHC workers on specifically the working conditions, the timelines that Nicholas has spoken to, the working hours, all of that. I think it's important to get that perspective from you guys, because it is, you know, your work and you have been doing it for the past 5 years. Again, receiving a quarter of what other people on permanent and pensionable are receiving. Yes, let's hear from you. Sorry, what's your name?
Immaculate.
Immaculate, all right.
So thank you, Mariam. Concerning the situationship in our working areas, for example, where I work, you are alone at night. When you're working on night shift, you are alone. It's either you are with a patient or you sleep alone.
By yourself?
By yourself. Then
So are you the only health worker at the facility?
No, but because we have shortages in the health centers, you find yourself working alone on shift, especially at night.
Right.
So if a patient, it's a level 3. So if a patient doesn't come at night, that means you'll spend the whole night alone with the soldier. So our security system is also a problem, because you're working with one person who is probably an old person who doesn't even have equipments to fight for you in case something happens. So, for example, this time I was working, even during the weekends, you're usually alone, unless something has changed.
Right.
But as far as we are concerned, currently, in the health centers, you work alone during the weekend and at night. So there's this night shift. No, it was during the day on a Sunday, I was working, and then a guy comes, a mentally ill person comes and started masturbating just right outside the facility. So this guy had done some due diligence and knew that I was working alone. And it had to take a lot of courage to come out of that place. Actually, a patient who was coming for treatment is the one who undo aliniokolea. She came, then the guy ran away. So when we reported that case, we were told to go and report to the police. And when you report to the police, the first thing they told me, there's no case. In case you are raped, nothing would have changed the situation, because this is a mentally ill person and we cannot even do anything about it. That is one. Two, I'm a victim of post-exposure prophylaxis. So we don't have risk allowance. That is one we should take note of. Our salary is consolidated. So working in the maternity is very risky for us as nurses. So you inject yourself, well, probably suturing an episiotomy, and you have to take PEP for 28 days. Everybody knows the side effects of those drugs. So it's really hard for us.
Sorry, I think for some of us who may not be in the healthcare industry, we actually don't know the side effects. But just for the audience, also tell them that, you know, PrEP is pre-exposure?
PEP.
Post-exposure
Yeah.
prophylaxis.
Yeah.
Okay. Yeah. So in the event that you're exposed to HIV, then you need to take it. What are some of the side effects?
Oh, sorry, let me just step in. I think we're about a minute to the break,
Okay.
but it's so important. Immaculate, please don't lose your trail of thought. I'm really sorry for what it is that you've talked to. We just want to appreciate that we're going into a quick break and also asking our audience to chime in. We'll hear from the officials. To Mariam's point, also hear from some of the UHC workers, read some of your feedback as well, but it's going into 8:30 a.m. right now. This is Fixing the Nation, NTV, Nation FM, and our digital platforms. We'll be right back to continue this conversation. Fixing the Nation, Mike Kwaground, NTV, Nation FM, and across our digital platforms. Janet Bogo and Mariam Bishar, we are on the ground with UHC workers talking about being underpaid, overworked, and insecure. It's a real plight that has been highlighted more so over the last few weeks, few years. And we were just hearing from one of them who's talking about her lived experience. So we'll hear more of that and then get reactions from the leadership. But just a quick one on WhatsApp Nation. Remember to hold your phone like this. I'm not trying to do a tutorial like Mariam. She says put it on landscape, say your name, what you're doing, where you are, and send that to 0112 500 400. And thank you to our fixers. We'll also hear from you a little bit later on social media. For now, though, we go back to Immaculate, who was talking about some of the challenges that she has faced as a UHC worker, and then we'll hear from some of the others. Immaculate, please continue with your story.
Thank you, Janet. So as I was saying, those are 2 episodes. When we got employed, most of us were sent to the health centers. Hizo ziko huko mashinani. And those places, you have to use transport of, like where I was posted, I used to use a transport of 250 and 250 to go and to come back. So that used to cost like 500 in a day. And you know, I was working for 5 days in a week. So considering that you have a consolidated salary, you had to have a huge support system for you to be able to work in those places. Again, we were employed during COVID. Most of us, we were so happy. Everybody was happy that you've gotten a job, a government job, well-paying, you're going to succeed in life. That is everybody's dream. So when we went there, I remember that place, I was so happy personally. And I even got pregnant. I got pregnant at the midst of COVID. At one time, when COVID was peak, I got infected twice when I was pregnant. And I can tell you, COVID was not a joke. You felt like you were suffocating. You couldn't even sleep at night. Remember, my pregnancy is here. Then my lungs cannot even help me breathe. It was stressful. Then here comes 3 years, no employment, another contract with the same salary. You are hit with rape. And then, okay, it didn't happen, but it took a toll on me. I had to go through therapy. I had a very supportive in charge, and the system there is very supportive, and colleagues. If it were not for them, I think I would be somewhere admitted in Mathari. So, you know, as for us as health workers, we cannot take care of you guys if you are not mentally stable. But that is what we're going through. So even if a patient comes and finds you in the hospital and you are crying, probably you have a child who is at home, you've not paid school fees, you've not paid house rent, na wewe ni daktari, huku nje wanakuita daktari. We wonder, what is wrong with our government? Do they see what we are passing through, really? Do we have to come all through this way for them to understand what we are going through? It has been a journey and a tough one.
Let me just say sorry, because your job is already risky as it is, but then sexual harassment at the workplace and you're feeling unsafe, it absolutely should not be the case. You also spoke of having to take PEP and the toll that took on your body. But for perhaps those of us who are not in the medical field, what is PEP and how did you get exposed to HIV and having to take it, and what were the side effects?
Thank you, Mariam. PEP is post-exposure prophylaxis. For us health workers, if you get exposed, probably when you are injecting someone and the needle misses and injects you, those are accidents that happen at work. If that person, you don't know the status of that person, you have to take PEP. and you have to take them for 28 days until that person is confirmed negative. And you yourself has gone through tests and you've been confirmed negative. Side effects of PEP. I used to have diarrhea a lot, vomiting. I remember one time I woke up throwing up in the morning. Sometimes you get, they affect the liver a lot. So your eyes turn yellow. Remember, we also have spouses at home, and you have to explain why you're taking ARVs, because they are like ARVs. In fact, they are ARVs. So you have to explain to this person why you're taking these drugs, and most of them don't understand. If you don't have a supportive family and a supportive spouse, then that is also the end of your marriage. So I had to explain a lot. You wake up in the morning, your appetite is low. If you take them on an empty stomach, the whole day will be hell. Yeah.
Again, I'm really, really sorry. That's the reason we're having this microground with you, because it's important that people know your challenges, not just from like reading in the newspaper or thinking, UHC workers want to be paid. Why? Why is it important that you guys are on permanent and pensionable, that your pay is commensurate to the work that you do, that we have a functioning healthcare system such that there's no day when Immaculate will be at the hospital alone, or that she has, to explain herself after, or all these things. These are structural issues. I want to hear a little bit more from lived experiences. And just the lady sitting next to me, I can see it's becoming a lot for you. Is it because of your own experience? No, it's okay. It's okay. We'll let you go through it. Mohammed had wanted to speak earlier. It's all right. We'll let you have a moment to breathe as well as Mohammed speaks.
Right. Yeah, thanks, Mariam, and yeah, we're all processing this together, and thank you so much for your honesty and courage for being here. We are going to go back to some of the lived experiences, just as Mariam has said, and then we're going to have the leadership now begin to respond. What is the leadership doing to try and motivate for change and shift change around it? So please just let us know a little bit about your role and just react to some of what you're hearing.
Thank you.
You can hold it up.
Thank you. My name is Mohammed Duba, the chair Kenya Health Professional Society, representing 19 health professional associations in the health sector. I'm also the Secretary General, Association of Public Health Officers, Kenya. This UHC and those who have been employed during COVID-19 provide commensurate service that is being provided by those of us who are permanent and pensionable. In 2020, we brought in these interns to combat unprecedented health crisis in this country. And as we have been explained, some of them have been infected and affected through that exposure. And we have agitated for the absorption, and it has not been possible. We have been on the street. We have been to the Senate. We have been to Parliament, and we have been to Avios. It is very frustrating that there's no goodwill from the executive and also the legislative arm. They have been crying. We have seen, you are hearing what they have been through. I think, is it that the executive, the legislative arm, are they heartless? We use these people to combat unprecedented health crisis in this country, and then we abandon them after the crisis was over. Some of them have been given, they have been given, I think, pay slips. Am I sure, is it true that you have been given pay slips? And then abandoned. These are heroes and heroines of this country. They are supposed to be celebrated. Now, those of them who are UHC in 47 countries, in 47 counties, are providing commensurate service that are being provided by those of us who are getting permanent and pensionable. And I think we need a goodwill from His Excellency the President. We need goodwill from our parliament, our parliamentarians, because these people serve them in their constituencies. We need goodwill from the governors. And I think there's a problem. Let them hear what they are going through and let them have a feeling. And I think that is what is lacking. And I think we are almost now desperate. Look at the many hours that we are on the street. Look at the many working hours that are spent at the gate of Parliament, at the gate of the Senate. We are calling upon His Excellency to give hearing, to have the goodwill, to have the heart and the feeling to absorb these people. Thank you.
All right, thank you very much. That is Mohammed Duba. We also have Lilian Mumina and a few other people in leadership around who are going to react to a lot of what is being said by the UHC workers, Odipo Nicholas, who'd also spoken earlier, Honorable Peterson Washira. We also have, again, as we mentioned, Mohammed, and we also have Brown Ashira. So they'll come back and just get a chance to respond to how they're pursuing justice for the UHC workers here. For now, though, we can try and find if anybody is open to sharing, you know, their shifts at work, what the day looks like, and just more of your lived experience. We'll hand it back over to Mariam on that side.
Yeah, I think Vanessa wanted to share on that before we hear from Lillian.
Good morning. My name is Vanessa, and I'm coming from Makueni County. I was posted in Makueni in 2020 during the COVID pandemic as a UHC nurse. So for the last 5 years, I've been working in Makueni County. And I can assure you, on a normal day, you wake up, unapanda boda all the way to the workplace. It may cost you 200 Kenyan shillings or even more. Once you reach there, you are waited to take a report, like any other nurse who is on PNP, who is earning almost 3 times or 4 times your salary. So you report and take a report, and you enter into the shift. Like my workplace where I work, we have a acute shortage of nurses. And by the way, we are 13 UHC staff in that facility. It's a sub-county hospital. We have 3 nurses. So you arrive at that working place, and there are 3 stations that are waiting for you. The outpatient, the maternity department, the medical surgical ward, and pediatric. Like my setup, we are 2 nurses on duty every morning. So you have to work in all those departments, the 2 of you. You have to check on the emergency department. And if the patients are waiting there for long and you are in the maternity ward, delivering a mother, they start making noise. They can even call the governor and report that the nurses are nowhere to be found because they are just waiting for an injection. So we have to circulate. We have to keep on moving for all those hours, for the 8 hours, from OPD to the medical surgical ward. In the medical surgical ward, you find all cases are there. All patients, may it be TB, may it be COVID, may it be any case is there, together with the also pediatrics. So you are exposed to all those conditions. You get COVID every now and then. Like me, I've contracted 3 times COVID. Twice when the COVID was at the peak, and just recently, I think last year, but 1 I also got. So you are there, and when you are about to start giving treatment, you are called at the maternity department, a mother is delivering, and you have to rush there. Remember, it is that salary, that consolidated salary, and it is exposed to all the deductions. So by the end of the day, you cannot even mention the figure here. It is embarrassing. So even your family, your spouse, keeps asking, "Wewe unafanyia kazi nini?" Because we don't see any input in this house, just because you're earning a peanut. So you go home very tired, and you cannot even find money. Like myself, my personal experience, my daughter qualified for the university the same year I was admitted. I was employed in that government, and she was taken to do bachelor's in pharmacy. It's a degree in Mount Kenya University, and school fees is 120,000 per semester. Just imagine with that consolidated salary, and you're expected to pay 120,000 per semester. You are expected to upkeep that girl. You're expected to pay house for her. How? Surely the government. How? Our CS. How? Our president. How can you manage that, to say the truth? 5 years down the line, she has finished. By God's grace. Debts are following you all over because of the school fees. But you can do nothing. And you know, the upkeep for a girl. So we have been working in hard ways. And we cannot do much okay, fine. You see us walking, dressed well, or even healthy, looking healthy like me, but we don't know what we are going through. So we are urging the government, if they can just do that one thing of giving us a salary that is worthy what we do, because we do a lot. At the end of the day, you're like a cabbage. You go home and you just rest, you just sleep. There's nothing else you can do, because you've handled like 20 patients in the ward, like 5 mothers have delivered, or even 6 in that hospital. There is even a referral that is supposed to be taken to the county referral hospital, and they are not nurses. You are just the 2 of you. So why is it that it has become so difficult for all of us who came in during that time? I remember when we were employed, the nurses who are on PNP went on strike. Who covered the hospitals? Yes, who? UHC staff, us only. Some wards were even closed, so that the UHC staff, the little, the few that we were, we can manage those other patients. We were left with only maternity wing because we could not manage, and we were there. We came in. I remember the isolation rooms. People used to fear them like nothing else. Even the relatives, they could not even, they did not even want to be associated with the patients. But who was there? The UHC staff. It is us. We were there looking after those patients, donning those PPEs. It's not easy. Even working with it, even staying with it for even 5 minutes. You sweat, you become breathless, and you are there and you can do nothing because you have to don. Go in and give medication to that patient. Or else they will keep on calling, they will keep on crying through the windows, saying, why have you abandoned us? Calling nurse. And you know nurse, dear daktari, like in all the hospitals. Unasikianga tu nurse, daktari, ni sisi. The clinical officers also are on the ground. Doctors, wanakuja wana review patient and they go. But you find now the clinical officers there, the nurses there constantly. So kindly, the government needs to do something. And not 2026. They need to do something now. This budget of 2025-2026, they need to allocate us money. Even that gratuity, we need it because that is our pension. For God's sake. The rest are enjoying their pensions. They are in their accounts. When they retire, they will get their pensions. We need that gratuity. At least they can boost some of us. Because I actually feel for men who are working with us and they have families. Sometimes I wonder how they manage. They keep on asking for fare. Nisaidie, daktari nisaidie na kamia. Familia yangu haina kitu. At least some of us who have husbands who are supportive, they can support us. But that man who has a housewife and he's a UHC staff, how do they even survive with that peanut? It is surely difficult. The trainings, like for the last 5 years, we've not been given any trainings. UHC staff, we don't go. We are discriminated big time. And we are not even allowed to go for study leaves. Even getting your annual leave becomes a fight. You will fight and fight and fight. By the time you get it, you don't even want to go. And even if you want to go, what will you do? Because you do not even have money. Yeah, so it is that serious. Let's get our PNP and our gratuity, and we shall really appreciate. It will really help us big time. Thank you so much.
Thank you, Vanessa. And let me just say, first of all, a big congratulations to your daughter, and to you. You've done an amazing job, given the hardships, the circumstances. So well done to you. I know it's not easy at all. I want to hear from Lillian as well, who wanted to speak, but I hope that there's a clear picture here coming of the working conditions that UHC workers have. And this is a bigger problem. We had Peterson, when we first had him, was talking specifically about clinical officers. We're talking about UHC staff now. We've talked to doctors. We've talked to nurses. There's clearly a healthcare problem, and it's a systemic one. And there seems to be, no impetus, no motivation to actually fix it. But Lillian, what did you want to say? And also we'll hear from Global Fund as well.
Okay, good morning. So my name is Lillian Momina. I'm the National Treasurer of the Kenya Union of Nutritionists and Dietitians. And maybe just to echo what the other leaders from the other unions have said, as the leadership in healthcare, we have actually taken every step that we can do for this matter of UHC to be resolved. We have gone to Senate, we have gone to the National Assembly, we have pleaded and even begged the government through the Ministry of Health, and the arrogance of the executive is wanting, because we cannot have a government that is claiming to be implementing UHC and the same core people or the people that actually hold it together, they are being ignored. We cannot have UHC without healthcare workers. As unions and as healthcare unions, we have petitioned every office that they have seen. And the other day, someone said that we need to improve advocacy and to make sure that we are heard. We are wondering what can they hear about the Kenyans that I've talked to today? Why can't they listen to a Kenyan who needs to have equal pay? You know, it's very demoralizing. I can imagine myself having to go to work and doing the same hours, maybe even more, because now your contract is it's not harmonized. So your terms are totally different. You have to work even extra or else you'll be discarded because you're not even sure about your tomorrow. That is quite unfortunate. And we are the same healthcare workers who are supposed to be taking care of these Kenyans when you come to the hospital. And as Immaculate has said, you cannot treat someone if you're not okay. And to the government, they cannot be playing this game that they have been playing of pushing us everywhere. Like when you go to the national government, they're telling you, oh guys, you guys are working in the county, your issue should be solved there. The other day we had the head of the COG actually complaining that he cannot afford to take in the UHC, and the CS actually told us that he will actually transition this UHC staff to the county governments. And up to date, there's no clear communique about how he's going to make sure that that actually works in favor of the healthcare workers. And you know, in Kenya, if the healthcare workers are not okay, healthcare will not work. We are currently having the executive at the Ministry of Health. They are in Geneva reporting about how UHC is working, how Kenya is implementing and thriving when it comes to UHC. And you wonder what is happening. We are in the streets every Tuesday. We are in the streets every other day. So what exactly is working? If my mother or if my grandmother goes to the hospital today, she will not find anyone to actually attend to her because we are on strike. And the CS and the permanents, the principal secretaries are there actually claiming that UHC is working. Nini inafanya kazi surely. We need accountability and we need to be taken serious as healthcare workers.
Absolutely. Thank you so much. Maybe just in 1 minute, let's hear from Global Fund. We're about to go on a break, but yeah, give us your perspective.
I thank you, Mario.
Just a bit closer here.
Thank you for this opportunity. I want to give just a brief history about the Global Fund staff. We've been working since 2009 on a contract basis. When it reached 2021, GF Global Fund decided not to give out human resources. So they wanted the government to absorb all of us. But since we were approaching elections of 2022, the permanent secretary, who was Susan Mochache, said we appealed for the Global Fund to pay us till 2023. So that 2023 were to be absorbed, all of us. But what happened, we were given another 6 months contract since January 2024 until June 2024. We were paid for those 6 months, and the people who are working in the government, national government, were absorbed to permanent and pensionable, while those of us who are working in the counties, we were left stranded. Until now, we don't know what to do. We don't know where we are. We were just asked to wait for the government to agree with the counties, respective counties, so that they could absorb us. So since June 2024 last year, we have not been paid until today. It's now 11 months. We don't know what to do. We don't know where we are. We are just urging the government to pay us for the 11 months that we've worked for and to absorb it as they did to the national government staffs. We don't know what they used to discriminate us as those who are working in the counties. We are requesting for them to look into that. Thank you.
Thank you. We're about to take a break, but 11 months of work without pay. There's no newspaper article or anything that could do justice to this story better than hearing from healthcare workers. 11 months without pay, promises, working on a quarter pay, working in extremely difficult conditions, facing exposure, facing sexual assault. All these are challenges that our healthcare system is facing, and these are the people supposed to bring us into a world where universal health coverage is a reality. I don't know how that happens if we are not consistent. Recently, we had the CEO for the Intergovernmental Relations Technical Committee. I can't remember the acronyms, but basically between county and national government, right? The body that's supposed to make sure that devolved functions are devolved, national functions are devolved. Healthcare seems to be one of those where there are no clear delineations on who takes care of what. UHC workers are being ping-ponged between national government and county governments. Global Fund workers, those who worked for county are left hanging. Those who worked for national are absorbed. We're on a short break. We'll be back with #FixingTheNation NTV. Let us know your thoughts on this. Share, contribute. The comments are overwhelming on YouTube, but please do continue sharing with us. We'll be back.
I want to cross over back to Mariam, who wants to unpack a pay slip, I think is what she said she has, and then she'll also hand over to somebody to give us another angle and perspective on UHC. Mariam.
That's right. Now, one of the UHC workers here has shared with me, because it's good to speak from a point of knowledge and facts, and we have speak to their lived experiences. And of course, can't share because it's personal data, whose it is. But let me just give you an overview of what the deductions look like. From a basic salary of 50,000 shillings, there's loan recovery from HELB that goes 3,000 shillings. There's a loan of 20,000, NSSF of 1,000, payee of 6,000, SHIF of 1,375, housing levy fund of 750 shillings. The deductions add up to 32,641 shillings, leaving a net salary of 17,358. Now, that figure already should worry you and send alarm bells. Even if you decide the loan is a personal choice, that's not a statutory deduction, that's fine. Let's add the loan back to that 17,000. If it would have been 37,000 shillings for a healthcare worker who is frontline, battling disease, ensuring healthcare coverage for every Kenyan, every citizen where they work, trying to find a way to make Kenya healthy, happy, all of those. For that kind of work, I don't think it is anywhere near commensurate. And of course, we've talked about how UHC workers are getting paid a third, a quarter of what their counterparts are getting paid. And if we're being honest, even those counterparts are still not getting paid enough. So for them, it's a problem on top of a problem on top of another problem. Those deductions, whether it's loans, etc., if that's what you're meant to live on and still come into a hospital and provide quality health care, it's incredibly hard. So I think it's important that we recognize the sacrifices being made here. Insurance is an issue that we wanted to speak to, and Shiro wants to speak to it as a medical professional who also has medical issues, because it's not that doctors, nurses, clinical officers don't get sick, and they also require the same level of care that we expect of them. But Shiro, please speak to your experience.
Yeah, my name is Shiro Kihara. I'm a registered nurse, and also I champion and fight for the UHC healthcare workers as the national chairperson of UHC nurses. And one of the reasons why I fight for them is because as a UHC nurse myself and somebody who suffers from endometriosis and adenomyosis, me tackling this issue of health insurance is something really personal to me, because as you have heard of how the payslip is, when we started out, we had a comprehensive NHIF cover. And even then, because I've undergone 4 surgeries so far, and even then, you'll find that the cover, you are told that you have a limit of around 700,000 inpatient. But when it comes to covering conditions like endometriosis, it's only able to cover like 80,000, and then you'll have to fundraise. For example, my first surgery costed around 1.2 million. And I had to call for a fundraiser, okay? And
you'll find that I'm not the only one who perhaps is going through such, but it is such a pain to know that I'm expected to wake up in the morning, go serve patients, while I myself cannot afford the health care that I'm providing to others. You'll also find that as somebody who lives with such a condition, where I used to work initially, I used to spend 600 shillings to and from work from such a kind of a payslip. Even without a loan, you'll find that it becomes really difficult. And right now, as we speak, after we moved from the NHIF comprehensive to SHA, it's only able to pay 80,000 shillings. I had another surgery last year, and I had to come after I recovered, maybe like a month after the surgery. I was on the streets demonstrating because I cannot afford health care. And it becomes so difficult when I'm the one providing, but I'm not able to be accorded the same services. And you also find that because we do not have, a lot of the privileges that those people on PNP have, you'll find that maybe if you do not have a supportive leadership at the county level, you'll find yourself having to suffer through it. Sometimes you'll find you are redeployed and you are not even given time to kujipanga and uweze kuenda, and it becomes so difficult. Now, the other thing that I want to talk about on this healthcare, right now as a UHC staff, we do not have a comprehensive cover. You wake up one morning, you go to the hospital, you are told you are not covered. The next day you go, you are told you are not covered. As you can see, I also wear glasses. I mean, we are not able to afford anything when it comes to healthcare. Sometimes you see with endometriosis and adenomyosis, 1 minute you're okay, the next minute you're not. I could be like the last demonstration that we had, I left the streets and I went to the emergency room because my body had just malfunctioned. And upon arriving there, I'm confident that I have SHA, but it did not work. I now had to find people who can changa and pay for me. So it's such a difficult thing for us.
Yeah. Thank you so much. Let me go over to Janet, because I know there's another aspect of everything, aside from just the permanent and pensionable employment terms. Now the issue of insurance, is it part of the permanent and pensionable terms? But what else are we agitating for UHC workers as well?
Absolutely. Now, I know we have such little time, so we'll just try and encourage everybody to just share what they can in the most succinct way, just to allow everybody to share their experiences from policy and experience. But please go ahead.
Thank you so much. Once again, I'm Brown. I want to say this. It is sad. It is frustrating. I don't know which camera am I using. I want to speak to government. It is a sad state, but this is not a laughing matter. A country that thrives of UHC, and we speak big about UHC. We have a president that speaks big about UHC. Then when it comes to the ground, nothing is working. I have two clear cases. I'm a public health officer. Public health officers in this country, we are the first line of defense. We interact with the people at the border points when they're coming in and when they're going out. We do screening, and we have two cases of my colleagues who contracted TB. And I have a colleague in Kilifi, we have colleagues in Laikipia who contracted TB. They battled TB. In fact, they even were isolated from them. In fact, even the drugs for TB, they are very expensive. Imagine these colleagues do not have even the insurance. They battled, they were isolated from their families, and they were left on alone. We have a country and a president, or rather a ministry, that talks about UHC, but we don't even care whether they get this insurance. I want to urge the president, and I want to be very categorical. Please, if you know you have no business in doing UHC, we rather tell Kenyans the truth. Because you cannot talk about talking about taking care of the Kenyans, the patients, when the health caregivers, the caregivers themselves are being trampled upon. Now, the insurance bit is one that's actually hitting us so hard. It's very funny, you go and handle a patient with a very good insurance cover when you yourself alone, you are not being insured. So it's important. And I think it's the picky ponky, the games that the politicians and the council of governors are throwing in. Somebody go to matangas and go to social gatherings. They throw balls, they throw what to each other. You know, the cat and mouse game. I think it should not be, this should not be a country of such a kind of a thing. We need to have a serious country where such a things need to be addressed. And I want to tell Dr. Nyekal, I'll mention him because he's actually on the dailies talking about setting aside monies. It is high time we move away from the speaking bit. We want to see those monies being allocated. And by the way, for your information, if that thing's not good, because these colleagues do not have insurance, you don't expect them to, even if they fall sick, you don't expect them to get whatever they need to get. So we need to see that money allocated to the ministry. The ministry should do its bit, appropriate, get the budgets correctly so that we can be able to have this thing far and beyond us. So thank you so much.
Yeah, maybe one of you can also speak to Shift and Shine, how all that has disrupted and what it's meant for access to healthcare as well.
Okay, thank you. Now, hearing the stories of the UHC staff, it is heartbreaking. And any serious person somewhere should start acting on their issues. Now, all these things that are happening, to me, I see like slavery is coming back to public service. Because when you find people are not paid money that is commensurate with the work they do, then that means that there's slavery. I also want to talk about, before I talk about Chief, the statement that the governors made on Wednesday. It is quite unfortunate because they said that the CS wants to transfer his problems to the counties. Now, when did UHC staff become a problem in this country? Yeah? Because these are people who are employed to come and help the country get out of COVID era. Yeah? So such reckless talks, even if these people had the heart to move, they will not move. Because they are now a mistake. They are a problem to the people who are supposed to be looking into their welfare. If you look at what is happening at the counties, health is devolved. And that's a fact that we must accept. The UHC staff have been working, this is the 6th year. Counties have been employing people. But when the UHC staffs apply for those positions, they refuse and tell them you have a job. Yeah? If you come to the Afia House, that is the Ministry of Health, you are being told that they communicated to the governors that whenever they are recruiting, they give priority to the UHC staffs. But that is not happening. Reason we cannot understand why this cannot happen. Somebody somewhere has just decided to frustrate workers of this country. Finally, is about the issue of the Global Fund. These people started working in 2009, way before devolution came into being. When transition of functions to the counties was being done, their payroll was held at the Ministry of Health. Right now, they're being told to go and seek employment at the counties. How then do you go and seek employment at the counties which did not employ you in the first place? Yeah? They refused to transition that, which means by that action, these people falls under purview of Ministry of Health. And they are the ones who are supposed to take responsibility. Let me see, the last one. I want to talk about, okay, thank you.
Sorry, I know I will come back to Mariam soon. We still have to go over whether, is it that you don't have insurance at all? Are you covered by SHA? Somebody can speak to that, and also police brutality. So we do need to try and address as many issues as we can. We'll do that and then come back to Mariam. So just very briefly, because we still need to talk about police brutality. Are you able to speak to Shif and SHA? Okay. About death?
Yes.
Okay, I think let's give you a chance to do that before we cross over very briefly. Thank you.
Hello, Kenya. I'm Patricia Wanza Mutiso. I'm among that neglected group of Global Fund. I was employed in the year 2009, and I reported on duty on 2nd April 2009. And since then, I've been working under the TB program. We have worked seriously giving data that is used for the government, the Ministry of Health, to get grants. Initially, we started with a job group G. And we worked under job group G up to, I think, 2016, when it turned into, we pushed up to job group H, and that is where we are. For the 16 years, I remember one of our cleaners calling me Ambamba 20. What are you telling me? And it happened like so. I wanted to talk about what is happening in Global Fund. It has gone too much on our side. For example, if we look at April last year, we lost one of us.
It's okay, Mom. It's okay.
Just because of somebody's negligence. The money is there. We are not paid. Every time we go to have your house, we are told your things are being talked about. When we went there and we asked about it, we were told, anyway, somebody's death is no problem. Anyway, somebody has to die. Is that a response to somebody who has been giving health care to people? We've been suffering. I remember one time people went for a strike, and my in-charge was somewhere, asking, where is Patricia? Has she also gone for strike? Doesn't she know that she is under program? I used to cover the lab alone. Alone, and I mean alone. Everything, you are called here, you are called everywhere. And when we ask about it, we are told your job is just but a phone call away. As I speak, I lost my father just because I'm not on pay. Illegally, I'm forced to go to work. Yes.
Hang on, let's just give her a moment. Please allow us to go through to Mariam, as we just gave her a chance to decompress, to speak to somebody on that side, then we'll come back here. Over to Mariam.
I'm looking at a list of some healthcare workers, nurses from all around the country, UHC workers who've lost their lives. And I have a list here of 44 names from UHC Kenya of nurses who've lost their lives in the line of duty. Are they preventable deaths? Are they systemic issues that could have led to their deaths? Are there ways to prevent loss of life for healthcare workers, as we expect them to prevent loss of life for the population at large? I want to speak also to police brutality before we go to anything else, because you've been on the streets, and as with every other strike, mandamano, whatever you want to call it, the reaction has been the same. Please speak to that, Lillian.
Okay, thank you. So basically, as a union, you know, going to the street and taking your people on it is part of your duty. So when you have when you have presented your petition, when you have begged the people who are supposed to listen to you and they don't, then the labor laws actually allow us to go on the streets to actually ensure that we are heard. Now, unfortunately, we also understand the fact that our current CS, jeshi ni power yake, sindo? So that has not been happening over the longest period of time. I think I've only seen like 1 or 2 cases where it was with our other union. But recently, they decided to open arms and fight Kenyans, healthcare workers who are actually protesting to actually fight for their rights. We have one of the UHC healthcare worker who's currently admitted. We also have another one I tried to call her to try and see if she could come, but she could not, because she told me, like, Mumina, I'm not in a position, I'm not mentally okay, I'm not physically okay. She fell, she's physically impaired. So when the tear gas and the rubber bullets were flying, she fell down. And unfortunately, she was stepped on.
When did this happen?
On Tuesday. This like last Tuesday. So we are asking the government, you cannot fail to bring us justice and then you now start harming us. It's quite unfortunate. And as the unions, we had Dr. Washira the other day talking about and giving them 14 days notice so that they can they can give an account of what has happened and how they are going to deal with it. But unfortunately, we know how Kenya things are. We know that if this is not talked about enough, they are going to just throw it under the table, as things always do. And it's quite unfortunate. We need to stop that. And the deaths, like you have talked about the deaths. We have a recent death, like a UHC worker died the other day, akikuja yo maandamano. You leave your house, come in to fight for your right, and then you're messed by an untimely death. Of course, that might not be the issue in the ministry, but still, if they did not have to come to picket, maybe they will still be around. So we need to have responsibility, and the arrogance at the ministry, I don't think that is talked about enough. As she has said, anytime you go and bring some petitions to the ministry, those people are usually very arrogant. You cannot be there to serve Kenyans and unatujibu venye unataka. It doesn't work that way. The healthcare workers are here to serve your people, because at the ministry, you are working for Kenyans and the healthcare workers are coming to work for them. So why are you being arrogant, and why are you sidelining and dealing with issues that you think are priority instead of what is actually affecting Kenyans? We understand that our PS, Dr. Oluga, is a doctor and is a KMPDU enthusiast. But we cannot have the ministry actually working for one specific union. Kenya is broader than that. Kenya is broader than that, and that needs to be effected in how things are being implemented and how issues are being solved.
Thank you so much. We'll get now into the fixes. We've seen your working conditions. We know the problems. And like I said, within universal health coverage as a whole, for universal health coverage workers, for clinical officers, for doctors, it's a systemic issue. But I want to now get to the fixes. What does a working system look like? So one, permanent and pensionable basis for UHC workers. That is one agitation of yours that is consistent, that is clear. Beyond that, what else do you need to be able to do your work effectively? And I'll ask us to be brief so that we find as many, because I want to start with what you need to be able to do your work effectively, and then the broader healthcare system now.
Okay.
Yeah.
I think we can give a chance to Peter to answer to that. I'm even speaking to whether you've met with, Mr. Ndwale, whether he's listened to your plight as you answer some of what Mariam has asked. Start with, have you had a conversation with him? What has he said?
Thank you. And, in different instances, I've been asked what motivates me to be on the streets and to be advocating for healthcare. And I think if anybody has listened today, you now know my motivation. Allow me to first contextualize what has been talked about, especially the case of the Global Fund staff. That was a clinical officer in Nyeri. And I think we must say that the clinical officer committed suicide. We have a lot of cases of mental health. This was after some months without pay. And not only committed suicide, but also took her child with her, killed her child. There are many cases across this contracted staff from Global Fund to the UHC. UHC has lost 45 health workers since the start of the UHC. But then, before I even come to whatever we are doing to fix, let me contextualize this conversation so that Kenyans understand why it's about them, even as we talk about ourselves. You know, in this country, we are guided by policies, we are guided by visions, we are guided by international documents. The World Health Organization has directed the countries that we should be able to implement the universal health coverage by year 2030. Also, under the leadership of the late President Mwai Kibaki, we gave ourselves a vision. And in that vision, we said that by 2030, we should be a medical tourism destination. And we even go down to break it into bits. And we say, in terms of the human resources, for us to be able to reach there, mind you, also actualization of universal health coverage by WHO is by 2030, is that Kenya is going to invest in the health human resource in terms of specialization, in terms of ensuring that we have adequate capacity, so that by 2030 we have enough in the system, but most importantly, we have enough that are specialized and sub-specialized in the system so that we can attract other people from outside to come to Kenya. The other fact I want to share is that in 2013, ourselves as a country, under the leadership of the minister then, C.S. Macharia, we went to the HRH conference in Brazil, convened by the WHO, and we signed a commitment as a country that realizing the gap in the human resources, and that we wanted to achieve universal health coverage by 2030. From 2014, we signed as a country that we will be employing 12,000 healthcare workers each year. We're only talking about 8,551 over a period of 5 years, but we are not even able to take care of them. And I'm trying to cast out the irony and the sarcasm behind this, because as a country, we posture as a country that, and as a government that really wants to take care of the health of the citizens, as a country that is trying its best to achieve universal health coverage. But even the commitments that we set out, we cannot be able to do. Now, I must say that, do we have the capacity? The leadership that we have currently has the capacity to actually be able to resolve this. The problem is the goodwill. We have P.S. Oluga. He was my fellow unionist just the other day. We know the CS Duale has the political capacity and is close to the government. He can be able to mobilize resources. On the side of parliament, we have Dr. Nyikal, who is an authority in the health sector and understands these things. And so we have everybody that we need. We have the knowledge that we need. We have the capacity that we do need. What is lacking is the goodwill. For us to be able to harmonize, because first is harmonize and end discrimination. Pay them as you are paying the others that they are working with. Equal pay for equal work done. Number two, convert their contracts into permanent and pensionable. And you know, when you look at our laws are very clear. The Public Service Commission Act provides on how you engage a public officer. And it says that if the work they are going to do is not work that is time-bound, it is something that continues in perpetuity, the only modality that is available to engage those people is permanent and pensionable. So the government is breaking the law in terms of the mode of engagement, but also on the side of discrimination. As my colleague said, our Constitution under Article 27 outlaws discrimination of anybody. But when it comes to the workplace, the Employment Act now breaks it down to what is discrimination at the workplace. And it provides that if you have two people who are doing work of equal value, but you are paying them unequally, that is discrimination. So this is a clear contravention of rights, the labor rights for these workers. And we can be able to resolve this because if you look at Article 223 of our Constitution, it provides that even if money is not budgeted for, but the government has an issue of urgent concerns they need to resolve, they can actually be able to appropriate the money outside the budget, because now they're talking about the budget, and then later they can report to Parliament. That is allowed, and we have seen it happen. So it is the goodwill that is lacking, but there are mechanisms to be able to resolve this, and that is why we are saying that where we have reached, His Excellency the President must intervene to ensure that the rights of these workers are upheld.
Right. Just before you let go of the mic, Peterson, unions have, championed for healthcare workers for a long time and continue to do so, but sometimes you hear disgruntlement that the deals are brokered only benefit a few. How do we make sure that whenever there's a person representing healthcare workers at a negotiating table, that the deal benefits all?
Yeah, actually, some of the narratives are actually pushed by the government so that workers do not engage in unionism, because unionism makes them strong and they can be able to bargain. But I can assure you, anytime we have set out to achieve something, you remember the other time we were after SHA? We have achieved SHA, and now for us as clinic officer, we are able to participate there. We have been able to probably get some other things like risk allowance. I know the nurses have already signed their CBA.
Sorry, you're not able to log on to SHA as clinical officers?
As clinical officers, our facilities are now registered and we can do our procedures and we are paid. That is something we fought for as a union. But I must also say that we have come together, and today I'm also here as the chair of the caucus. That is why you see my counterpart union is here. And we have resolved that if after 14 days we do not have a clear way forward on this, we are actually calling all the health workers out. We are going on a joint nationwide strike to ensure that this casualization of labor, that is actually going to affect healthcare. And by this I mean, if we continue with contracts, these people, they cannot be taken by the government back to school to specialize. They cannot also go on their own volition because the meager pay cannot support them to specialize. So if we continue with this casualization, we are seeing with UHC, with Global Fund, with CHAP, with county contracts and the others, I can assure you, by the 2030 that we are supposed to have super specialized hospitals and medical tourism, you will be going to other countries to get those specialists. You will not get them in Kenya. And that is why we are fighting.
Okay. Mariam, there's one or two people who want to share. Again, there's some voices we also haven't heard from. We'll give you a chance and then we'll cross over. Just very briefly, please go ahead.
Okay, thank you.
We'll just hold it close to you.
We are saying that the UHC is pegged on three issues: affordability, accessibility, and quality. Listening to the UHC staff here, are Kenyan getting quality health care? Definitely no. Our constitution envisages that all Kenyans must be available to the highest standard, attainable to the highest attainable standard of health. So the UHC is not working because Kenyans are not getting quality health care. If the UHC they cannot put food on their table, they cannot be able to pay for the house rent. Can they really provide quality healthcare service to Kenyans? Definitely not. So the whole thing, the whole issue of accessibility, affordability, and quality healthcare service provision is a sham. And so once more again, as Washira put it, I think what is lacking is the goodwill. We don't have goodwill from His Excellency. We don't have goodwill from the Parliament. We don't have goodwill from the executive and ourselves from the Senate and as well the county government. So I think if really there's a goodwill to solve this issue, it can be done like yesterday.
Okay. Thank you very much. Okay. You hold on. I'll come to you next.
I am a pharmaceutical technologist under the UHC program. We were all employed in the year 2020. Some of us were employed in May, others were employed in June. What I would like to speak about is our salary, how it is consolidated and we have no allowances. So after working for a few years, I got a transfer request. And it was still within the county, but it was a very far part from where I was currently working. After getting the transfer request, I decided to talk to my friends and people we were working with, and they were telling me, why don't you go and ask for your transfer allowance? Disturbance allowance, that's what they call it. Because if you are transferring to anywhere more than 10 kilometers from your place of work, you are entitled to a disturbance allowance, which should be equivalent to your basic pay. So I went to the counties. Counties told me, no, your payroll is at the national government go ask the national government. I went to the national government. The national government, they're telling me, but you are a county employee. They're the ones who have given you the transfer request. Go back. There's so much back and forth. After that, I had to just go back to my savings and deplete them and just take everything I had and move to where I was moving. It was draining, honestly. So much debt. It was a little bit tough, to say the truth, but we overcame. All along, just trying to survive, trying to get the little that you can, trying to manage. Honestly, it's hard, to say the truth. We are supposed to have allowances, housing allowance. We can't even be able to get proper housing. We are supposed to even get, at the end of every year, healthcare workers are supposed to get uniform allowances, which should enable you to buy new uniforms yearly. For 5 years, we have not gotten that. Most of us still have the same scrubs we started working with in 2020, 5 years down the line. Most of us still have the same lab coats we were working with 5 years down the line. Honestly, the government is not fair to any of us. We are asking Ruto, our president, why is there discrimination? He just seems oblivious to the fact that we are suffering. In the Kenya Kwanza government, they categorically stated that UHC was a big part of their government, but they seem to have left it all out. We're just asking the president, please just look into this matter and look into it fast, because the budget is coming up. We can't afford to lose more time. Next year, the contracts are ending. Those who are saying that we be put in next year's budget, our contracts will be over. We will be at home. So how can you be put on a permanent and pensionable when your contract is already over? That makes no sense. Honorable Duale, please kindly ask the ministry why they were able to absorb those people, those UHC workers who are working in the national government facilities. But the rest of us in counties, nothing. We're being told there's no money for you. Just continue with your contract until the end. There is no goodwill, and honestly, it's draining. It's draining mentally, it's draining physically, it's draining emotionally.
Right. Thank you.
Okay, good morning. Patricia. Patricia is a community health officer. I'm working in Nairobi, and I was employed in 2020 during COVID. And actually, personally, I survived COVID 4 times. And I always thank God for that. Because we were in the front line, helping the government to curb the pandemic. But what happened, everything went well. Now people are free. People are moving freely. We can laugh, we can cough without any problem. But for us UHC staffs, we are left just like that. They don't want to hear our issues. They don't want to understand whatever you are going through. So it's so sad. We are sad people. As a community health officer, I'm manning 8,000 households. So if you multiply maybe per household 5 members, that is like 40,000 people in that ward. So when government was looking for people to register SHA, they came to us as officers to help them convince these people to have their SHA registered. And we did that. Now the government is pocketing a lot of billions, but they don't have money for UHC staffs, which is very sad. We only need 15 billion for us to have our PNP and to have our gratuity. So I'm telling President Ruto is the man in command. He has the voice to command for our PNP and gratuity. So if he can't do this, then we have nothing to do with them. They just give us our gratuity, we go home. Because we can't be frustrated in our home. We are not slaves in this country. We are citizens of this country. We are people who are born in this land, and we deserve to be treated fairly and equally. Yes,
Thank you.
Okay.
And as we move on to that side, I would love to get more of the fixes from you. The permanent and pensionable and your gratuity, we've heard, and we will continue to ask duty bearers when they come on the show about it, as we have asked before. But if there's any other fixes to the system, specifically for UHC workers and wider for the healthcare system, including shift share, all of that, please feel free to share as well.
Okay. So we'll hear from you, Maureen, try and hear from Dennis, and one more. We'll try and hear from as many more as we wind up. Go ahead.
Okay, thank you so much, NTV, for giving us opportunity to air our grievances. And I am Maureen, a clinical officer working in Nairobi under UHC program. What I would like to say is that the clinical officer are always on the front line when it comes to care of the patient. We are the first people to see the patients. And now, my experience while in UHC, serving in Nairobi County, we see it for a longer time, serving Kenyans. The queues are long, especially in dispensary in Nairobi, exposing most of us to danger, like miscarriages for female clinical officers. I once encountered the miscarriage, which even my colleagues are not even aware. And right now, the clinical officers, there are those allowances, the risk allowances that we also need, because we see TB patients, we see HIV patients, we are on the front line. And more so in those dispensary, we even don't have people like farm techs. I can tell you in Nairobi, where I've been working, I am a clinical officer, I am a farm tech, and in fact, being in NCD clinic and each and every person, every part of the healthcare to ensure that it runs smoothly. So we get exhausted, and that is how I came up to get a miscarriage. Another thing that I would like to say, I am telling it to the CS, Eden Duale. You spoke that you don't have funds to make us permanent and pensionable. That is none of our business as the healthcare workers. It is you to come up with the budget and take the budget before the health committee, and we will not be ready to keep on listening even to the people qualified as health personnel like Dr. Nyikal, who was just talking that we signed a bad contract. How is it that we signed the bad contract? So coming to the issue of SHA, in fact, when I got the miscarriage, it was the time when NHIF was transitioning to SHA, and I could not get the service at the night that things have changed from NHIF to SHA. So I'm appealing to the government. Right now we are aging. We need permanent and pensionable. We need our equity, our gratuity that we've worked for the 5 years. The clinical officers are there waiting to be absorbed into permanent and pensionable. Thank you so much.
Thank you, and so sorry about your experiences. Dennis, very briefly, before we hear from one other person. Oh, I'm sorry. Do you have the mic? Okay, go ahead. Very briefly, yeah.
Good morning, everyone. My name is Dennis Nyabuto, working in North Health Center, Marsabit County. So here we have been talking about medical governance, policies, governance, all of that one. So under governance, we have a human resource. So the human resource, we're supposed to implement UHC, which is appeared in the Kenya Kwanza Manifesto. The workers who are supposed to implement this policy, they are on the roads. Today, it is the 97th day on strike. And we are being told we be put in the budget of 2026, 2027. Last year, there is a communication from the Minister of Health by the PS Mtoni, dated 2nd April 2024. This communication was seeking an approval from the Minister of, from the Public Service Commission, so that the UHC, can be factored in the 2024-2025 budgets. So what happened? Were we factored? If we were factored, where is the money? We were told the ministry has 4.2 billion, which was to be added 3.5 for us to be converted into PNP. But here today, we are being told by the Health Committee to be factored in the 2026-2027 budget. So how are we going to trust this government again? We are tired. We are tired. It's enough.
I'm sorry to interrupt you. From today's story on the Daily Nation, a committee of the National Assembly has proposed an additional 47 billion to go to the Health Ministry, including let me see how much is going to UHC workers. 8.8 billion, yes. So that figure, should this additional budget be approved and funded, I don't know from where, would we call for an end to the call for a strike, if that makes sense?
The only time we are going to go off strike, off the roads, is when we receive our permanent and pension operators, when we get our gratuity in our accounts.
All right.
We are
Someone
tired.
else wants to respond to that as well. Thank you.
And she hasn't gotten a chance.
My name is Maureen Zioka, National Treasurer, National Union of Nurses. Let me just say it's a sad state of being here and leading a team of nurses who are always bleeding, working with them and working with them. It's really frustrating. We've seen what they've been going through, and they have already narrated everything here. And my cry and my plea is that even the Kenyans, us as Kenyans, that us nurses we serve, need to hear this and come on board with us and cry to the nation and the country that they need to hear and understand what nurses go through in this country as we give services to all Kenyans. Just to answer on what Marion had said about the budget of that health committee had raised, it was on Tuesday that we went to meet Dr. Nyikal, the head chair of health committee, with other two members. And we discussed, because he wanted to understand what exactly do us UHC nurses need. And we were open. It's not just being permanent and pensionable, though that is one thing that we really want. Behind it, there are so many other issues. We want their terms being regularized as per SRC guidelines. Two, we want them to get their gratuity. But again, this is where the tie comes. It's because the Ministry of Health, when they sat down giving out their budget, they did not consider all the money for UHC workers. That is the National Government Ministry of Health. And we feel frustrated when we see our nurses out there. When we go, we have had so many meetings with the Ministry of Health concerning the same issues, and they're not doing anything about it. But
time. Okay. Let me just get a clear answer. Okay, if they're able to avail this 8.8 billion shillings.
Okay, this is what Dr. Nyikal told us, that they're going to sit down and they have understood what we have said, and they're going to the health committee. And since there are several committees with the parliament, he said that he's going to sit down, and we're happy this morning we saw that he has put aside 8.8. They've come to an agreement of 8.8 billion. But we don't just want to hear about the put aside. We want to see it implemented. We want to see our members that are nurses, or that money is there, because they said they'll have to go, already the budget is at the ceiling, so they will sit down and relocate this amount. But how sure are we that it's not just a word of say, or it's just a word by just kutupaka chupa mafuta. We want to see that this money comes to these nurses. Okay. We want to see this money go to UHCs. We want to see, and do not even take a lot of time, because we're already tired. This is our country. We are serving the Kenyans. If suppose we are in a different country, how will this Kenya treat us?
I'm so sorry to interrupt.
Yes, thank you so much.
Almost completely out of time. In 30 seconds, I think, what remark you want to make, because we are completely out of time. Please speak, yeah.
Thank you very much, NTV, for giving us this chance. My name is Pauline, working in Kajiado County. We were employed on 2020, as it has been echoed severally by my colleagues. And when we were employed, we believed that this is our opportunity for us to reach to our dreams that we always wanted. But it became an environment where most of us are risk to depression and other mental, because I want to clarify exactly like what we are earning. We as UHC, we understand that as the pay slip has been led by Marion, you find that we get maybe a minimum or a maximum of 30-something thousand, while our counterparts who are in PNP are running 80K and above. Maybe if we were to be redesignated from the years that you have served, right now, we could be earning more than that 80,000, because already job group would have gone higher. It has been a very painful moment, and beside that, as I finish, it got even more tougher and even depressing when we saw our other UHC being absorbed in the last year, October. And for us, we were left behind. So kindly stop sidelining us.
Yeah, we're really completely out of time. If there's anything else that can be said, Mariam and I will find a way to amplify it next week. We are on a broadcast timeline, and unfortunately, we have to sign out and cross over, to your world. But thank you all. I think our hearts break collectively with you. We applaud you for your courage, and hopefully we'll continue this conversation again. Fixing the Nation, Mariam Bishar, Janet Bogwa, Eric Latif. We'll be back here on Monday, but please, we'll try and see if we can bring this conversation over to the following week in studio. Thank you, everyone. Have a great weekend, and let's keep UHC workers in our minds.